Hi, in today's video I will show you how to manage gestational diabetes. Welcome to Diabetes Free, the place where you get advice, motivation and inspiration for a happy and healthy life. Of course, diabetes free. If you've been diagnosed with gestational diabetes or are worried it could be a factor in your pregnancy, you probably have a lot of questions and are definitely not alone. Thankfully, gestational diabetes can often be managed with diet and exercise alone, and it doesn't mean that you won't have a healthy pregnancy. Let's talk about gestational diabetes, how it's treated, and what you can do to help tackle it with the right foods and activity. But before that, if you want to see more videos about how to reverse type 2 diabetes, please subscribe to the channel, like the video and tick the notification bell. I also have in the description my free PDF with 7 tips to make your life instantly better as a diabetic. Gestational diabetes is diabetes that only occurs in pregnant people. That means you can't get gestational diabetes unless you're pregnant. Gestational diabetes is defined as high blood sugar that develops during or is first recognized during pregnancy. During pregnancy, the way that your body uses insulin changes. Insulin is a hormone that allows your cells to absorb and use glucose, or sugar, for energy. You'll naturally become more resistant to insulin when you're pregnant to help provide your baby with more glucose. In some people, the process goes wrong and your body either stops responding to insulin or doesn't make enough insulin to give you the glucose you need. When that happens, you'll have too much sugar in your blood. That causes gestational diabetes. If you have gestational diabetes, maintaining a healthy, balanced diet may help you manage your symptoms without needing medication. In general, your diet should include protein plus the right mix of carbohydrates and fats. Too many carbohydrates can lead to spikes in your blood sugar. If you're craving some carbohydrates, make sure it's the good, complex kind, think legumes, whole grains, and starchy veggies like sweet potatoes and butternut squash. If you're diagnosed with gestational diabetes or are at risk for developing gestational diabetes, ask your doctor about working with a registered dietitian who specializes in gestational diabetes or nutrition during pregnancy. A dietitian can help you plan your meals and come up with an eating plan that will keep you and baby healthy with foods you actually like. Aim to base your meals around protein, healthy fats, and fiber. Include lots of fresh foods and limit your intake of processed foods. Those French fry cravings can be hard to resist, so aim to keep healthy alternatives around the house for when cravings strike. What's more, filling up on satiating choices like protein-rich foods can help you stay satisfied so you're less likely to crave less nutritious items. Although carbohydrate tolerance can vary significantly among pregnant people with gestational diabetes, recent research shows that a diet providing less than 40% of total calories from carbohydrates is generally ideal for promoting optimal blood sugar control. However, keep in mind that your carb needs and tolerance are specific to you. They depend on factors such as medication use, body weight, and blood sugar control. Work with your healthcare team, including your doctor and registered dietitian, to come up with a plan to promote optimal blood sugar control during pregnancy that suits your individual needs. Snacks are great for keeping blood sugar levels. Here are a few healthier choices for snacks and meals if you have gestational diabetes. Fresh or frozen vegetables. Veggies can be enjoyed raw, roasted, or steamed. For a satisfying snack, pair raw veggies with a protein source like hummus or cheese. Veggie omelets made with whole eggs or egg whites. Whole eggs are an excellent source of many nutrients while egg whites provide mostly protein. Steel-cut oatmeal topped with pumpkin seeds, unsweetened coconut, and berries. Fresh fruit paired with a handful of nuts or a spoonful of nut butter. Turkey or chicken breasts. Don't be afraid to eat the skin. Baked fish, especially fatty fish like salmon and trout. Sweet potato toast topped with mashed avocado and cherry tomatoes. Unsweetened Greek yogurt topped with sunflower seeds, cinnamon, and diced apple. And yes, you can still eat fruit if you have gestational diabetes. You just need to eat it in moderation. If you're concerned, or want help keeping track of the carbs that are included in the fruits you'd like to eat, talk to a registered dietitian. Berries are an excellent choice as they are relatively low in sugar and high in fiber, so get ready to stock up and toss them into a smoothie, on some yogurt, pickle over some whole grain oatmeal. Controlling diabetes is not merely about switching to a healthier diet or incorporating some physical activity into one's daily routine. It is more about a complete lifestyle overhaul. Apart from exercise and diet, shedding excess weight and taking steps to manage both physical and mental stress are some of the other ways to keep the disease under check. A positive lifestyle change could not only help you control diabetes but also brings your medications down in the long run, helping you lead a better quality of life. This is why I created a free guide for you with 7 tips that can reverse diabetes type 2 without drastic lifestyle changes and extreme exercise plans. Click on the link in the description and download the free guide. If you want to watch more videos on how to reverse type 2 diabetes, make sure to subscribe to my channel. See you next time.